Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and if you follow our channel, you know I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, and butts. Thank you so much. Today, our topic is going to be facial fillers, and specifically cheeks and lower face. And I'll tell you why this is a kind of a hot topic. So first of all, I've been doing cosmetic facial surgery for decades. And that's included the jawline, the jaw, the chin, the tear troughs, the cheeks. And it's so funny with fillers because as more and more people do fillers and there's more and more FDA indications, people are discovering the chin. So, when they discovered the tear trough, you saw all these tear trough injections. When people that didn't have experience in those areas discovered the cheeks, you saw all kind of cheeks injections and on and on and on. And that's okay, it's not a bad thing. But I'm seeing a lot of problems. So I'm going to talk about these, but first I want to talk about the fact that overfilling is a big problem. And I'm going to show you some caricatures about overfilling and explain this. And it has become almost a norm in some places to be overfilled. And if you look at the Kardashians and some of these social media influencers, they're way overfilled. Their lips are too big, their cheeks are too big, they just don't look natural. And then all the pretty little girls and or men, they go on social media and they see these celebrities doing this, and then they get overfilled. And so you have all these people out there that they don't look natural. So one problem is when you talk about filler facelifts, okay? And I've done over 1,500 facelifts. I do about 110 a year. And that's the only procedure that is really gonna naturally and effectively tighten the droopy skin for longevity. Okay? And I see patients that come in here and they've had 12, 15 syringes of filler in their cheeks and their side of their face and their jawline and all of this trying to correct something that you can't really correct with fillers. Now, jawline fillers are great and I do them myself, but I'm starting to see so much overfill. I'm seeing females that look masculine because they have this big wide and pointed jaw. So you've got to really be careful. And, to call something a facelift that's really not a facelift, it's just not fair. And I see a number of patients that come in here and literally have spent over $15,000 on a single session of fillers. And, it might last a year or so. And it's just not gonna, unfortunately, I'm a really good example here. It's not gonna help these jowls and this extra neck skin, all right? It's gonna be very temporary. And it's really unethical. You'd be much better off saying to somebody, look, your problem is skin excess, not volume loss. You need to go see a surgeon and have a facelift. Now, that's kind of the negative side of it. The positive side, boy, you can give somebody better tear troughs, better cheeks, better lips, better jawline definition, better mandibular angles. But you got to make them look natural, okay? And, if you just Google pretty females or pretty males or handsome males, you see what our concepts of beauty are, and they're classical. The Mona Lisa, Leonardo da Vinci, they all through history there's classic beauty, and it obviously varies by gender and even by race, but we know what looks normal and what looks. So you see so many overfilled patients. I'm going to show you some caricatures. I'm working on the 3rd edition of my Facebook Cosmetic Facial Surgery, and one of my doctor friends from Malaysia, Dr. Ting Song Lim, put together these really neat little caricatures about overfilling, and you can see that people just look ridiculous. They look like caricatures. When you go to the fair, you go to an amusement park and you get a caricature drawn and they take off on your chin or your nose or my hair or whatever. So you don't want to look like a caricature. And if you Google filler complications or overtreated patients, you'll see what I mean. But unfortunately, you don't even have to do that. There's just too much overfill. So you've got to have the standard correct. And I don't think that the Kardashians and a lot of these social media influence are a good standard. I just think they're overtreated. And then people think that's how they're supposed to look, and then they're overtreated, and then the doctors are overtreating people. So anyhow, that's my little rant on overtreatment. I think that These applications for fillers are great, and I think that you should start slow and progress, and there's a time when you need to cry uncle, and putting more in that is going to be a problem. So if you're a patient, beware, you want to look natural. If you're a doctor, you know, if somebody has a lot of skin excess, it's really not fair to make them spend thousands and thousands of dollars on filler when that's really not the correct operation. And I've seen too much of that. So anyhow, thank you so much for your time. I'm Dr. Joe Niamtu, lovethatface.com.